in today's episode of OMH Dailies, let's understand how a party drug called ketamine can act as a quick antidepressant and the relationship between air pollution and brain disorders. We will also discuss why Omicron is less likely to cause long COVID than the Delta variants and why women are more likely to suffer from long COVID than men. So let's head straight towards our first headline. Can ketamine help treat depression? Ketamine is often used in clubs and rave parties where it can intensify music and the experience of lights and atmosphere. However, a recent study published in Nature Communications states that a single dose of ketamine can decrease depressive symptoms within hours compared to more common antidepressants that can take several weeks. Its effects on the brain can also persist for up to 3 weeks. Previous studies show that even those patients who are resistant to antidepressants respond to even a single dose of ketamine. However, since ketamine can have strong and severe side effects like blurred vision, nausea, insomnia, drowsiness, and addiction, it can only be used for a limited amount of time. While ketamine's beneficial effects do not seem to last as long as those of some psychedelics, the latest findings have offered a deeper window into how these drugs can be used for the treatment of depression. Polluted air contributes to brain disorders. Air pollution contains many toxic ingredients which may lead to severe diseases such as asthma, chronic obstructive pulmonary disease or COPD, and lung cancer. Now, a new study has found out that polluted air may also cause neurological disorders and brain damage. According to a study published in the Proceedings of the National Academy of Sciences, a cocktail of many toxic compounds could be transported from the lungs to the brain via the bloodstream while breathing in polluted air, potentially contributing to brain disorders and neurological damage. Once in the brain, the particles were hard to clear and were retained for longer than in other organs. The study has revealed a strong link between high levels of air pollution, Alzheimer's-like changes, and cognitive problems in older people and even in children. The findings offer new proof in demonstrating the dangers of air pollution to the central nervous system. Omicron less likely to cause long COVID than Delta. A recent study by Lancet states that the Omicron variant of the coronavirus is less likely to cause long COVID than the Delta strain. Long COVID is defined as having new or ongoing symptoms 4 weeks or more after the start of the disease. Symptoms including fatigue, shortness of breath, loss of concentration, and joint pain, which can adversely affect the day-to-day activities. The researchers found that the odds of experiencing long COVID were between 20 to 50% less during the Omicron period versus the Delta period, depending on age and time since vaccination. But still, 1 in 23 people who catch COVID-19 are going to have symptoms for more than 4 weeks. However, the absolute number of people experiencing long COVID was in fact higher in the Omicron period. This was because of the vast number of people infected with Omicron. Women are more susceptible to long COVID than men. Moving on from one topic of long COVID to another, a study published in the journal Current Medical Research and Opinion states that the odds of females developing long COVID syndrome is 22% higher than males. It is unclear why women are more susceptible to long COVID than men, but according to researchers, it could be due to differences in how women's immune systems respond to infection compared to those of men. Researchers from the Johnson & Johnson OCMO say that females mount more rapid and robust innate and adaptive immune responses which can protect them from initial infection and severity. However, this same difference can render females from more vulnerable to prolonged autoimmune-related diseases. Notably, women may also be at greater risk of exposure to the virus in certain professions such as nursing and education. Stand on one leg and predict mortality. Everyone knows that balance is very important in life. But did you know that it may also help predict your demise? According to a study published in the British Journal of Sports Medicine, the ability to stand on one leg for at least 10 seconds is strongly linked to a lower risk of death over the next 7 years. Middle-aged and older people who could not perform the 10-second standing test were nearly 4 times as likely to die of ailments like heart attacks, strokes, cancer, and more. Researchers have known that balance and mortality are connected, as nearly 7 lakh people each year die as a result of a fall, according to the World Health Organization. So why don't you try this and stand on one leg for at least 10 seconds? That's it for today. Stay connected with the world of health by subscribing to Only My Health. Goodbye, stay healthy, and keep watching OMH Dailies.